Let's get to our expert, bringing in NBC's senior medical correspondent, Dr. John Torres. Dr. Torres, good morning to you. We talk about the triple pandemic, and like a lot of families, our family has had firsthand experience with this, checking at least 2 of the 3 boxes, RSV, flu, and COVID we're dealing with right now. Flu, it appears to be surging in a lot of places. Look at this, 15 million infected right now, hospitals overwhelmed in many places, nearly 1,000 Americans dying each week from the flu. What concerns you the most about that?
And Peter, CDC came out this week with information saying that in some areas flu is declining a little bit, but at the same time the warning was that flu has not given up yet, and flu cases are probably going to keep increasing. And like Miguel said in his piece, that death rate and hospitalization rate is higher than it's been in 10 years. And so we have to be concerned about that. But on top of that, you have to remember we have this tripledemic, this tridemic happening with COVID and RSV as well. And if you look at what happened statistically last winter, starting after the holidays, we start having that surge in COVID cases. Didn't come down until mid-February. So we are just at the beginning of what potentially could be worsening of all 3 of these cases here. Hopefully things keep going in the trajectory they're going now with COVID and RSV, where they're either plateauing or starting to come down. Flu and RSV, where they're plateauing and starting to come down. And then COVID hopefully doesn't have the same reaction we had last year. I don't think we'll get to the numbers we had last year, but I think we will see a surge in COVID after the holidays because of our gatherings and our travel are the 2 big things that are going to be causing that, Peter.
Well, Dr. Torres, let me follow up with you on the concerns about a potential surge and the fact that this is happening as families are gathering all across the country for the holidays. I guess the question for folks is, should they do anything differently this holiday season, or is it okay to get back to normal?
And I think the main thing they should be doing differently is trying to get back to normal and trying to get with your family and loved ones this holiday season, because we haven't been able to do that for the last couple of years. And now is the time to do that, but with safety in mind. And remember, especially for those that are vulnerable, hopefully you can get vaccinated or have been vaccinated for flu and COVID, the 2 things we have vaccines for, because that offers you the best protection. At the same time, masking is the other tool we have that can really help protect us from getting it. And if you're in an environment where there are those that are vulnerable, the elderly, immunocompromised, the very young, then definitely take those extra precautions. Ventilation is still a big key. If you can open windows, if it's warm enough outside, definitely open windows during gatherings. But have fun this holiday season and just take those simple precautions to try and help yourself and everybody else out.
And Dr. Torres, there was one survey that really struck us. This is the Kaiser Foundation, and it shows that 28% of Americans who were surveyed last summer were against the MMR vaccine requirements, measles, mumps, rubella, for school children. That is up from 16% in 2019. Americans' opinions of vaccines clearly have changed as a function of the COVID era. What are the implications of that?
And, it's very disheartening because this is something that has increased through the pandemic. We knew it was an issue before, but now we're starting to see measles outbreaks in Ohio because of low levels of MMR vaccine. And the concern is, where is this going to go moving forward? The pandemic has polarized a lot of this resistance to getting the vaccines because of misinformation and disinformation, both those adding to this problem here. And is this going to continue to go on, especially for children who we know can be vulnerable to some of these diseases? This is a public health issue, and this is one of those things that, none of us likes to go in and get a shot. That needle in the arm, none of us like that. But at the same time, we know it's healthy for us. And if you look at experts around the world, if you look at doctors around the world, especially here in the U.S., they're getting vaccinated. They're vaccinating their families. And if that doesn't tell you how safe we think it is and how important we think it is, then I don't know what else to say about that other than, the facts behind the vaccines. And yes, vaccines do have some side effects, but the side effects from the diseases and the death rates from the diseases are much higher without those vaccines.
Yeah, Dr. Torres, we're going to need your expertise over the next several weeks. We hope you will stay healthy. Thanks for your time this morning.
All right. Thank you. You too.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.